Welcome to Legend Information. White blood cells fight viruses to protect the body from infections. Type of white blood cells: neutrophils, lymphocytes, monocytes, eosinophils, basophils. Neutrophils. Function: they're the first line of defense. Neutrophils attack and ingest bacteria and fungi through a process called phagocytosis. Amount: they're the most abundant white blood cells, making up 50 to 70% of all WBCs. Lifespan: short-lived, a few hours to a few days. Location: quickly move to sites of infection or inflammation. Lymphocytes: they're divided into two main types. B cells produce antibodies that bind to viruses, bacteria, or toxins to help neutralize or destroy them. T cells attack infected cells, cancer cells, and help activate other immune cells. General function: provide long-term immunity, adaptive immune response. Amount: around 20 to 40% of all white blood cells. Special feature: they can remember previous invaders for faster response in the future. Monocytes. Function: monocytes are large white blood cells that also perform phagocytosis, engulf and digest pathogens and debris. Once they move from the bloodstream into body tissues, they become macrophages, which are even more effective at destroying pathogens. They also help alert other immune cells by presenting pieces of pathogens. Antigen presentation. Amount: about 2 to 8% of white blood cells. Lifespan: can live for several days in the blood and even longer in tissues as macrophages. 4. Eosinophils. Function: eosinophils mainly fight parasites and play a role in allergic reactions. They release toxic substances that kill parasites and contribute to inflammation. Amount: around 1 to 4% of white blood cells. Lifespan: a few days. Special role: often increased in number during allergic responses and parasitic infections. 5. Basophils. Function: basophils are involved in allergic and inflammatory responses. They release histamine and other chemicals that contribute to inflammation and allergy symptoms. Amount: the rarest type, less than 1% of white blood cells. Special feature: similar in function to mast cells found in tissues.